And so good afternoon, and thank you very much for attending this web chat, the Jersey Chamber web chat, which is Reconnection for the fitness and sports industry. Thank you very much to all of those who've joined us already. I can see that we're already a good number of the 60 or so that have registered for today. I'm delighted that we will have with us today two of those in public health who have been leading the unfurling and strategy ready for a reconnection for the fitness industry. They, like all of you, are very passionate about this sector returning, and today we'll be discussing that approach, the next steps, the draft options, and how the relaxation measures are linked with the number of factors and the unintended consequences that need to be considered in the decision making. So let's meet those two who will start off by giving you a presentation of the thoughts from public health at the moment on the policy and the strategic policy, and then let's go from that to the Q&A. Now you will notice at the bottom of the screen there is a little Q&A box. The Q&A box at the bottom is where you can put your questions. We've had some in advance and we'll make sure that they get passed on to our two panelists who are with us today that you can now see. We have Martin Knight, who's the head of public health policy, and Steve Harvey, who is the strategic policy officer. And I'm Murray Norton. I'm the Chief Executive of the Chamber of Commerce. We've been liaising between the industry and between government in order that we could get to this point. And very much like that in the non-essential retail, in the close contact industries, and indeed with the hospitality industries. Chamber has been very much engaging with government, finding out the requirements that are needed and the safety protocols that are going to be put in place, and then liaising with that industry. And I know the fitness industry have been in contact with us, quite a few of them actually over the last week or so, in order that we get a meeting like this. So I'm grateful to the States of Jersey and to Public Health for doing so. Well, Martin Knight, Head of Public Health Policy, and Steve Harvey, Strategic Policy Officer. Welcome to you both. Thank you very much indeed for being there. We've got a very well, I say brief, it might not be so brief, presentation for you to take us through. Steve and Martin, this has been a difficult industry in order to collate all of the things. I think we're going to see some of the considerations for that, and no doubt we'll have some questions afterwards, but perhaps it's best if we hand over to you so that you can give us your thoughts to start with, and I'll share the screen.
Lovely. Thank you very much, Murray, and good afternoon, and thank you from myself as well for your interest and for your support in understanding how we can work together to move forward through kind of reopening of the sector. So Murray, if you just want to share the screen. So Murray's going to help support us with the a few slides today. So we're doing things slightly differently than we've done for some of the other sectors. We're discussing options pre-guidance at this point because of the implications for the decision-making process that both the scientific technical advisory cell and also our competent authority ministers would be required to work through. So if you just want to go through to the agenda, which I know we've given a bit of a feel for, Murray, but so effectively we want to briefly talk you through this morning the process that we go through in terms of decision-making that helps support the reconnection stages and what that means potentially specifically for this sector. We are going to talk through some of the variables and mitigations, so some of the issues that are most pertinent when we're thinking about how we can both protect staff and customers across all sectors, but specifically within indoor sport and fitness. And then the mainstay, if you like, I think of the presentation here is looking at what we have in terms of a decision point that our ministers invariably will be required to come to a position on, is the draft options. And we'll explain more about those. We will be, obviously, I know colleagues will have a number of questions, but following the back off today, kind of positions and understanding and viewpoints, particularly around the draft options, I think will be particularly important. So we will have a time for questions and comments, as Murray has said, through the questions field that we have through the Zoom interface. And that we say there was a consultation process, so we'll just tell you, briefly give you information in terms of how you can forward your views in terms of making your perspective known to us within public health. That can help support us in the advice, and as Murray said earlier, the implications that various decisions might have on your particular area. So that's what we're hoping to achieve today. I think we've gone through some of the things in terms of the meeting. So in terms of the process, so you can understand how this works from a government perspective, to a certain degree, obviously, there are some elements of bureaucracy, but that's around good decision governance, making sure government are able to show that they've gone through due process. So at this point, as you know, as Murray's explained, we've gone through consultation with a number of the key sectors. It has been more simple in other cases with more underpinning detailed complexity. I think in the case of sport, there's going to be a bit of both. So understanding from this point, we're doing some consultation events, obviously. As government officers, we work through some of the evidence base, some of the best practice. We're looking at some of our own local intelligence, and those things help inform some of the positions we take and the presentations we make during kind of engagement and consultation. I'm sure all of you will be aware we have the group called STAC, which is the Scientific Technical Advisory Cell. And what generally happens at that point is we take proposals, we take recommendations, and look for the advice of colleagues that sit on the Scientific Technical Advisory Cell. They don't make decisions. So that group's role specifically is to review various different bits of information that are provided to them through various routes, and to provide onward advice so that the ministers can make decisions in terms of how various options can be moved forward, and then apply the thinking and dates. So there's a lot of questions that are going, I think, around public at the moment around what does reconnection look like as we move into the future. We have been very much faced in the first instance through the kind of early stages of reconnection. Ministers are very keen to move forward into understanding a wider route map, if you like, in terms of looking at what that might look in terms of direction. And hopefully we'll be starting to hear a little bit more about that in the coming future. We then work at that point, ministers generally make announcements then about when various different areas and sectors will be released. And behind that, we then release the guidance and the law that has been required to underpin that. Now, both things work together, the two, we'll talk through some of the kind of wider issues then that kind of happen that relate to those kind of processes. But the fact that we have to do a number of things backed up now by the public health laws means that it does limit some of the flexibility that we have when we're doing stuff universally at population level. That's one of the blunt instruments that the law provides. And we can answer questions in relation to that as we move forward. So that's generally the process that we go through. I think what we will be seeing, just for your information, is that we will be making a presentation to the STAC group on Monday of this week, and that will move forward into ministerial meetings, which are currently scheduled, but sometimes move at some point in the following week after that. So when it comes to dates and assurances, we are, as officers, are unable to provide anything until our ministers have reviewed advice and made the final decisions on those issues. So we remain, to a certain degree, have to be kind of quite aloof, or at least providing general feel for direction rather than being able to clarify where we're going. So that's the overall process. So Mary, if you'd like to take us to the next slide. Most people will be aware we've been trying to go through a phased approach. We have been looking and reviewing how we work through the Safe Exit framework. We've looked at the guidance that we've worked through in the previous stages of relaxation as we came through that in spring into summer last year. we're also looking to develop and understand some of the local understanding of what happens as we went through into our phase and local epidemic, if you like, as we moved into Christmas. So we do things in phases. Government are committed at this point that most of the big phases will go through in 3 weekly periods, so we can watch and understand what happens next, to make sure that we are relaxing in the face of a safer environment. But within those approaches, there are a number of different key variables. So to help you understand, vaccination program is key and really important at the moment. We're looking good. So the vaccination program at this moment in time is working well. It's proceeding at the pace that we expected. But we are under kind of the restrictions of supply that come through the vaccination program that isn't under government control here in Jersey. So we are only able to continue that at the speed that we can. Additionally, we know that there are various issues around vaccination in terms of transmission spread. The evidence base around that is promising, but there is no robust evidence yet that the vaccinations, whilst they're around about up to 80% effective after first dose, we are finding, so that's quite good, but the evidence base around how it will impact on transmission at this point in time is not fully complete and robust. So we currently do feel quite well, and I think it's probably a frustration, probably of many of you listening to us today around numbers of cases, or what numbers. So we're doing quite well in terms of having had no new cases for a period of days, and that is great. But we have, alongside understanding vaccination and spread, and the point of where we think we'll have the majority of our higher risk islanders protected from vaccination, have to account for transmission. We also have to be wary of an understanding around new variants and the risk of new variants spreading within the Jersey context. We also know that we do have the UK variant, which there's evidence that it can be between 40 to 70% more transmissible, and aerosol spread in that environment, which obviously has implications on guidelines and on risk in terms of moving forward. And as well, adherence to guidance is important and will impact us moving forwards. And that's adherence not only by the business sector, which generally have had really great support for, and I know, having spoken to at least some of the key stakeholders who've been in touch from the gym sector, a lot of preparation from indoor fitness and business sector has been forwarded already, and a lot of preparations have been happening, and you'll say have been happening probably since March, April, when original closures had taken place. So adherence to guidance is there for businesses, but also by members of the public as well, and needing them to work with you, with us as a population. I suppose what we can see with having no new cases at this point in time, that we would appear to be doing quite well with the initial openings that we've seen happen to this particular point. But we do know as we move through a phased approach that anything can change. We might see increasing numbers of cases. We saw some concerns early on that delayed retail. But in addition, that can work both ways. We may well find that we start to get more robust evidence around vaccination protection, about it reducing transmission. And if therefore there is increasing confidence in the fact that the vaccination program will support a reduction in the transmission of disease, and then potentially the kind of particularly bad clinical disease where hospital pressures and onward deaths can happen, we might well see that we could bring forward certain changes as well. So it's a two-way street in relation to timings. That's all I wanted to say is a starter for 6. I'll hand over to Steve now, who will take you through some of the detail in terms of variables and then into the mainstay of the discussion around the options. Thank you.
Thank you very much, Martin. Good afternoon, everybody. Just before I try and unpack this eyeful of a slide, just to add to what Martin's just said and to be totally transparent with everybody, the process as explained is what it is, but we realise and accept that it's not an exact science, that there are sometimes inconsistencies, and you will all be aware of them, and that when decisions are reached, there is absolutely no chance that those decisions will please everybody. And And finally, I think on the kind of apologies, we have to take a universal approach. We recognize that in every single sector, everybody is very, very passionate about their sector. And every setting within every sector is unique and has its own particular setup and differences and configurations. It's just impossible to provide law and guidance for each and every aspect of everything. So it has to be a universal approach, which is, Martin used the phrase before, a bit of a blunt instrument. So we recognize that. However, it's what we are faced with. Our objective is the same as yours, is to reopen the fitness sector as sensibly and as safely and as quickly as is possible. And that's what we're going to go on to discuss with you now before we open the opportunity up for questions. The slide in front of us, headed variables, is something that doesn't make an awful lot of sense until hopefully I can just unpack it. What we're starting with here are a number of the things around the inner circle that have to be taken into consideration when we think about relaxing and opening up your sector. Things like the gatherings, the number of people involved, distancing, keeping people safe, physical distancing, how the virus is transmitted through aerosol transmission, how long people are involved in activities for, etc., etc. The next outer layer, which is color-coded, is even more complex. So when we start thinking about numbers and the number of people involved, we then look at where they are, whether they're indoors or outdoors, and what possible mitigations, outdoors being safer, might be appropriate. We also think about concurrent events, whether more than one event can go on at the same time in the same place. And at the moment, the green means it's happening. So outdoor sporting events with mitigations can happen concurrently, but they cannot happen indoors at the moment. We also think about what the phrase we use is waves. This is the word we're using to describe mass events which happen with lots of people, a running event, for example, whereby one group of people would be starting at a particular time, and then after a relevant space of time, the next group of people would start, etc., etc. At the moment, wave events are not happening, but that's something else that we need to factor in, more for the outdoor environment than the indoor. Spectators are something else which are not currently in the equation. Then we move round in terms of distancing and things like fleeting contact. Again, some of these are more relevant to some of the sports than they are necessarily to some of yourselves, but they are relevant across the piece. Whether somebody has fleeting contact, by which we mean momentary, short-term contact for a few seconds, or whether they're involved in more close-spacing contact, whether in face-to-face contact with people for a longer period. The current position remains at a 2-meter distancing across the piece. Again, there are some exceptions around distancing for children at school, and primary school children outside of school have a bit of a bubble arrangement in some settings. So that's something else that needs to be factored in. Then we come on to the bit in red, which is one of the key talking points around intensity, and whether or not intensity needs to continue to be factored in as one of the variables. Whether, when we move in a minute to look at some of the options, this will become clearer, whether we move to a position that we had previously, whereby low and moderate indoor intensity is permitted at first, and not higher intensities indoors, or whether we move to a position where everything can start at once. Obviously linked into this in terms of transmission and controlling the spread of aerosols, there are other considerations like ventilation systems, natural ventilation, mechanical ventilation, the wearing of masks, etc. and cleaning regimes and fallow periods, all of which we'll speak a bit more about in a minute. Other things to consider are how long do the activities last for? Are they short or long term? Areas of shared equipment and shared resources and touch points, which would also include things like shared communal facilities such as changing rooms and showers, for example. And Martin's already mentioned the vaccination program, which is a variable that's on our side that we are making good progress with, and are getting lots and lots of people through that process. So that obviously is a positive. What the slide doesn't do at all is make clear the interdependency and the relationship between all of these different things. So it's a rather static slide, but they are all interdependent, one on each other, and they're all interlinked, and changing one of these variables will almost certainly impact upon another one in relation to managing the overall risks. So we have to take a collective approach, thinking about these things collectively and individually. And the decision makers, that's really STAC and the ministers particularly, will need to be satisfied that we have got significant and appropriate mitigations in place with regard to all of these different variables, and we can do as much as we can to keep people safe if we're going to relax things further. And so all these things need to be considered when we're looking to return the fitness sector to being open again. I just want to say one little bit more about intensity before I move on to the bit that probably is what you're really wanting to see, which is about the options. So in terms of intensity, you will all know very well what we have done in the past. And when we come to looking at intensity, there are pros and cons, advantages and disadvantages around intensity being used as one of the variables. You'll know, as I say, what we've done before, which we've restricted it to low and moderate intensity activity, which was permitted last year when things were open. And since the start of the pandemic, that's the position we've been in, and strong recommendations against high intensity activity. So some of the pros and cons, starting with the pros, one of the pros for using intensity is we have done this before. It may not have been a perfect solution, but it was relatively easy to understand, and certainly most people in the sector understand it very well indeed. And risk assessments are already in place, and measures have been in place. So it's kind of tried and tested. It might be something in its going for it. Potentially, if you have low and moderate intensity only, then potentially lower levels of mitigations might be possible. So you might, for example, be able to have more people involved, for example. So that's another advantage. And it can support and reduce the risk of community spread by limiting it to low and moderate intensity. On the other hand, some of the reasons that are cons is that it's hard to define and enforce. It's not popular with some people or many people, both in terms of the sector and your clients. It's quite individual and subjective. It's not possible to write intensity levels into the law, so you have to depend upon the guidance. A greater reliance on the guidance is not always ideal. Sometimes the ministers prefer things that can be written in law that they can then absolutely be confident will happen. There are some political views that it's unhelpful. And the opposite of what I mentioned earlier is that if we have high intensity, there is a possibility that higher intensity mitigations will be imposed. And if the mitigations are too high, it might serve as a bit of a straitjacket and restrict what we can do, for example. So again, by example, if high intensity is included, it might mean that there are lower numbers that can be involved in terms of that. So there's another example of how these many variables are interrelated. Hopefully that makes a bit more sense than when you first saw it, but if it doesn't, we can always come back and explain a bit more. So in shorthand, these are the things that inform the way we progress to the next slide. Thank you, Marie, where we look at some of the options. I want to underline something Martin said before, is that anything can change at any time. So this comes with quite a big health warning. It's got some very, very indicative, provisional question mark dates on this. We are not able to confirm that those dates are going to be happening. We are just putting them up there as an indication as to when possibly we might see some changes. So this is all draft and optional and at the consultation phase. So the first approach would be the one here, is to have at the top of the page, no indoor intensity restrictions, by which we mean low, moderate and high intensity all resumes at the outset. Okay, and then we break it into a couple of particular phase 1 and phase 2, which are the ones I want to talk about. Phase 3 and 4 would come later on. So I'd like to focus on just phase 1 and phase 2 to start with. So Murray, if you would kindly move to the next slide, it just brings those two up. Thank you very much indeed, Murray. So when we think about phase 1 with all intensities operating, we would start to think about the variables that we spoke about previously. What number of people outdoors would be able to partake? At the moment, you'll know that we're heading towards 35 for everyone on the 8th of March, subject to everything staying relatively stable. So would that number increase, and if so, what to? Equally, with indoor fitness and sport, we'd look to what number would be safe and appropriate for the indoor environment. And there's just a range between 10 and 40 put forward there. And would staff, volunteers and officials be over and above the number of participants, or would they be included in the number of participants? And again, we've got a range there, just indicative. At this stage, the key intention is to get more people active as soon as possible. So we're not looking for spectators to be involved. That's a nice to have, quite frankly. The critical thing, and maybe not so relevant to your sector, but it is relevant to the sports sector, having spectators, that is. The key thing is to get people active and people back to going in and enjoying themselves in taking exercise. So if spectators are involved, they would need to be part of the gathering number, not as well as the gathering number. The bit in bold is the critical difference. This, as I said a few moments earlier, relates to all intensity levels, low, moderate and high intensity. We would look to carry on with the special arrangements we have for primary age children, whereby their bubbles are maintained. I spoke earlier about the wave idea, which is for outdoor events. We'd look to reintroduce the ability for events to be organised in waves so that more people can take part, so long as they're managed in smaller numbers and set off at different times. We'd also be encouraging people as much as possible to pre-book their slots, as much as anything to make it manageable for both yourselves as providers and for people as users, to make sure that they don't turn up when things are chock-a-block, and that there's a steady stream of people through your venues and facilities, rather than everyone turning up at once, where pre-booking would help. And finally, on the physical distancing, the 2 metre distancing requirement isn't going anywhere in the foreseeable future. So there would be a requirement for all concerned to maintain a minimum of 2 metre physical distancing. except where there's fleeting contact, a momentary short space of time when people might just be much closer together. So a tackle in football would be an example of that. And then if I turn to the next phase, which, bearing in mind what Martin said earlier, phases are ordinarily considered to be about 3 weeks apart. So I've made the point earlier, we don't know when phase 1 might start. Let's just pretend, for the sake of this conversation, that the earliest it would start would be the middle of March, 3 weeks away, 2 weeks away. Then phase 2 would probably be earliest mid-April, in that it's 3 weeks further on. And then we've basically got the same sort of approach. The numbers for outdoor could look to be increased. The numbers for indoor fitness and sport could equally look to be increased, as could the numbers for staff and volunteers. Then we would get to spectators not being part of the gathering, as was in phase 1, but being a separate gathering. So you might say, you know, spectators up to so many are allowed to come along to watch this. Changing rooms and showers, I haven't mentioned them much. They are not considered to be absolutely essential. I know they're nice to have, and people will say we need them open, but we wouldn't be looking for showers and changing rooms at phase 1. We would be bringing those in at phase 2. And the main reasons for that are, there is evidence to show that changing rooms, showers are areas that are quite difficult to monitor. They're areas where people tend to start sitting around and relaxing, and sometimes somehow letting their guard down. Therefore they have been, there's some evidence to show that they have been a source of local transmissions. They're also quite challenging in terms of, for yourselves, in terms of maintaining the fairly strict cleaning regimes that are required. So in phase 1, we're thinking, as nice as it would be to be able to change and have a shower, most people can get there ready to exercise, do their exercise, get away, get home, get out, get somewhere else, get changed and showered afterwards. But in phase 2, we would be hoping to reintroduce changing and showering facilities. Close facing contact with a consistent partner, time restricted. So this is where somebody's involved in an activity. I'll give the example of, what should I give the example of? Ballroom dancing, where you might be, you know, closely facing somebody who is the same person. So that might be possible to reintroduce, and the 2 meter distancing as before. I'm conscious of the time, so I'll skip on to the next couple of slides, and I won't spend quite so long on these. This option B, again, all the same caveats about timing and draft and subject to change, all those things stand. Fundamentally, there's nothing much different about these set of slides to the previous ones, other than it starts off with only, in the first phase, low and moderate intensity indoors. So at the beginning of this process, that would be all that would be possible. And we spoke earlier on, I spoke earlier on, about the pros and cons of using intensity. And then high intensity indoor activity would become part of phase 2. Other than that, it's pretty much a rerun of all the stuff I've just run through with you. So just to summarize that, 2 options, both phased approaches. Option A, the green one, no restrictions on indoor intensity levels, which may attract, having that approach may well attract higher mitigations and lower numbers of participants, possibly. Or option B, which is low to moderate being possible at first, with higher intensity being introduced at the second phase. And conversely, this may allow lower mitigations to be in place with higher numbers initially being involved. However, this is a consultation exercise, and this is all down to hearing from the sector and understanding from you folk who understand this sector absolutely down to the nth degree, your views, your thoughts, what you feel is completely unworkable, if anything, and what you like the sound of, etc. So that we can use that to inform the decision-making process. So thank you for your patience. I hope that makes some sense. And now we'll move to enabling questions and comments to be shared and responded to. Thank you, Mary.
Thank you, Steve, and thank you, Martin. We've had some questions and some chat coming in, and I'm going to go to those as quickly as I can so that we can get through these in the remaining 24 minutes that we've got left. If we don't get through your questions now, I will ensure that Steve and Martin get your comments and your questions after we've done this webinar, and we'll make sure that we get those reverted back to you as well. And you can, if you want to indicate whether you're happy for us to pass on your name as well, then we're happy to do that as well. Questions come in. Wouldn't the number of people depend on how many we can fit in a 2-meter distancing within our venue, within our place? So I think that's fair. That's a fairly clear one. It will depend on the size, won't it, of the venue?
To a certain degree, yes. Basically, what we're seeing is obviously some people have much larger spaces. At the current point in time, 2 meters will stand, and I think it will stand for a reasonable period in terms of we know that it's a good transmission break. But there still may be a requirement for those with slightly larger spaces, and outdoor spaces being the same, where a number cap is put on, because we know that the more people that you come into contact with, the greater chance for mixing and transmission occurs in those environments. But essentials will be based on the ability to maintain the 2 meter rule. But people must also remember that we also need to be aligned with the order in relation to gatherings. So there's laws on gatherings, and that means we have to be consistent across the whole population for those things. So at the moment, indoor gatherings is restricted to 10, as we'll have to review that so as to fit with a number of different aspects.
Okay, and I think Connor has asked the same question. Will the number of visitors as examples in both phases be based on the square foot, not a set number, i.e. 10 people? So about square footage or about numbers? At the moment, it's about numbers because of limits on numbers, but obviously square footage as it rolls out will also come into play. I think that goes back to Steve's fantastic slide. You obviously spent too much time with slide rules, Steve, on the variables. Let's go from...
Murray, can I just add to what Martin said about numbers? So again, it's back to the point that every single venue is very different. So the numbers may well be that within any particular area of a facility, there's a cap on the number of people. The 2 meters has to be maintained, but the view might be you still don't want more than X number in any one room at a time, you know, even if the room's huge. So that sort of thing needs yet to be decided upon, as to, you know, if it's high intensity, are there going to be 30 people crammed into a room, even if they're 2 meters as possible? It's one of those things that need to be sorted. Right.
Conscious that we get through these questions. Glenda wants to know how long we'll have for questions. We're on it. Thank you. How long does this last? It lasts an hour, and we're wading our way through it. I've also got lots of people in the chat box. Go into the Q&A box if you've got a question. The earliest we need to start this would be yesterday. There's people obviously desperate and passionate to get this open. I know you've mentioned that. So we just need to get open, I think, is the main comment. A question from Scott. There's actually a question. How would swimming pools fit into this opening strategy? Where do swimming pools? Because there are venues on the island that have got pools which form part of that fitness, be it swimming lessons or just recreational swimming. So where do they fit in?
I think swimming pools would be considered as it's another indoor exercise venue. Whilst we appreciate that the absence of, the presence of chlorine obviously can be create extra protection around touch points and various different environments, as we say, when we have limits that are implied by the law, then they apply to all indoor settings and environments. And I know we've had similar questions about that. So it's about what does an indoor environment look like within the in the way the law suggests and states that an indoor environment is. So that kind of does curtail us, and it's a blunt instrument.
Okay, I'm going to continue and wade my way through all of these. Glenda says, we agreed all of this weeks ago. We need to get this to ministers. Senator Farnham said they see us as high risk. So comment on high risk, not high risk?
So I think we know that there are transmission risks in the majority of settings. What we do know is that when we see community transmission starting to evolve, that there are a number of different higher risk environments where that have been identified as supporting and increasing community transmission. Internationally, we saw that internationally through the third wave. Locally, in October, we saw that too. However, what we do know is that the risks for transmission across all sectors obviously reduce in different ways when community circulation is low. So we do know that the risk lowers during that particular point in time. So as our community cases are lower, we will definitely see a kind of a much more reduced risk within those environments. We do remain to be quite cautious in relation to aerosol spread in particular. And we know obviously that as we're exercising, we won't be able to wear masks. So that does increase a risk within this particular sector. And similarly, and I know people have commented that the UK are moving forward in a different way to Jersey, but we can still see that it's a cautious and phased approach. They're not just opening gyms without it being done over a phased and risk-based approach. Clarity on that obviously is not there, but equally, as colleagues will see today and know today, that clarity is not there for our own sector as yet either.
Okay, yeah, there was comment on that. How do you justify these decisions in light of the fitness industry being opened first in the UK due to the science and data? Is the science and data different, or is Jersey different?
I think it's the way sometimes people review the science and the data. We have chosen to open outdoor environments first for fitness and for outdoor sport. We believe that we know that it is safer outdoors. Basically, we present the information and the evidence that goes through STAC, and then it goes through ministerial and decisions are made in that format. So it is underpinned by science. It's underpinned by kind of a number of other formats as well, thinking about well-being, thinking about economic impacts, and you know, recognising that the risks actually do exist in those environments. So whilst the UK are opening indoor earlier, we don't know yet how exactly that will look. It's quite restrictive in terms of they're clearly trying to introduce household mixing within the guidance, so only within individuals and households being able to exercise together. So, but we don't know what that will look like in the UK, but we are making the decisions for us within our own local context for Jersey.
Okay, a lot of frustration, as you can imagine, because these are businesses that want to open up. A comment here that says, much of this feels like we're being taught to suck eggs. We've been through this once in the first lockdown. We're well versed in the mitigation requirements per activity, and slightly shocked that we're so early on in the reopening process. I appreciate it's a process, understand that our sector is part of a bigger picture, etc., etc. But what we need now is a little bit more of a sense of urgency and a date that we can work to. When will we get a date? I mean, we did look at the if you like, the line of command. So the line of command goes next after this consultation and the process of what do you want, option A and option B. It then goes to STAC, and then from there. So how long is this all going to take?
So as we say, off the back of the engagement and consultation we've done this week, we'll be preparing papers over the weekend. You'll see we'll give you a deadline for any individual comments by, I think we selected Sunday for our own benefit. On the basis of that, papers will be going to our STAC meeting on the Monday. I'm very hopeful that we'll then forward to ministers in that week too. I'm always less confident of committing to ministerial thing, but they are scheduling meetings over that week. We do know that we have the next announcement for outdoor adult exercise on the 8th of March. I think it would be fair to say that it's not going to happen alongside the 8th of March. and therefore would happen in a phased approach at some point after that date. I'm not going to commit to anything because I'm sure there will be ministers that will be that fall on different elements. Some ministers, we want to see it happen faster than others. They will be taking the advice that they received from Monday from STAC and making a position from that point forward. So we're saying mid-March, as we had in the presentation. We're saying mid-April for a following stage, but it is subject to other variables that are outside of our control, and also decisions that are made anywhere elsewhere. So as officers, we are generally nervous to say what ministers will actually agree to.
Okay, I'm going to keep this fairly brief here. Malcolm says 2 metre distancing isn't being adhered to in restaurants at tables. Well, it should be. I'm not going to comment any further on that. I'll waste more time on it, but thank you for pointing that out. It should be, and people are out there trying to check on it best they can. Lucy's saying it's just a little bit slow getting us to open again. I tend to say I agree. Is this just buying time? Not acceptable that Boris can give 7 weeks, but Jersey can't give any time whatsoever. So you can sense the frustration there. I don't ask you to comment on all of that because I've got loads and loads of questions, and I'm going to try and get through them best I can. How do you justify these decisions in light of the UK opening fitness? I think we've done that. Martin, you promised to give us some data. We haven't had any data yet. Could we have some data?
Our data's been released in various different ways through the freedom of information points. We provided data. I haven't got the data right in front of me. We have seen spread in a number of different indoor and outdoor exercise environments. I'm not going to quote them because they're not in front of me. So they've been released publicly by various different inquiries through the media and through otherwise. And perhaps off the back of the response, we'll issue those again.
Okay, Steve, what do you mean by aerosols? As in body spray, or do you actually mean the aerosol of vapor coming from people's mouths?
Okay, so, yeah. So you've got respiratory.
Go on, I'll give it to Steve then. Go on.
So I wasn't talking about antiperspirants. I was talking about the viral aerosols that are released and are the way that the virus is transmitted from one person to another, and which is why many of the mitigations are so important. So I was talking about the transmission of the virus through aerosols and droplets. Okay,
all right, thank you. So
there are two differences there, Murray, as well. So we've got kind of the heavy respiratory droplets that were expelled, as we cough, sneeze, loud talking. And then we've got generally the kind of wider, smaller aerosols, which is the reason why COVID-19 has managed to transmit so well in community environments, whereby those aerosols tend to hang in the air for longer, which is why ventilation is one of the key things. It's more than but I know colleagues are much aware of that.
Right. With regard to the data, can you send me the links, Martin, and I'll send them out to other people because they've gone out in all sorts of different areas and FOIs and the rest. Save us hunting for them. If you've got the links, send them to us. And we'll send them.
We provided more detail into answers from some of the Exercise Alliance in terms of questions they provided through you as well. So I'm happy for you to use that information.
Okay. Could you explain the logic for hair salons, massage parlors, chiropractors and the like being open, who can physically touch you, but gyms are not allowed to open, even though they can keep them at 2 meter distancing? Is this down to the expressing of those vapors at intensity? Is that where it comes to?
It's quite a challenging environment, and as Steve said, it's not exact science to move through some of those things. There's a big difference. A lot of obviously the chiropractors, osteopaths are using full professional personal protective equipment. They are only seeing one person at a time. It's quite controlled. You don't get the same opportunity to bump into numbers of different people in those environments. It's generally at a smaller level. All of those environments you're able to wear masks. We talked about aerosol spread and respiratory droplets. That is a concern, particularly with new variants. So in a gym environment, you've got a potentially, or an indoor environment where we're exercising together, the opportunity to move around more freely, albeit within 2 meters, and obviously being able to come into contact. We've got respiratory droplets being expelled. greater numbers of touch points when people are able to move freely around. Yes, mitigations can be put in place, but yeah, it's a matter of needing to make a staged approach. You can't open everything all at once. You need to do things in a phased approach. That was World Health Organization based evidence in pandemic responses and moving out, and there's good evidence that we should do that carefully and slowly.
Okay, why can't one-to-one sessions resume? These could be easily adapted to the rules and don't involve crowds of people. So there's a lot of one-to-one coaching that happens with the fitness industry, the wellbeing industry. Surely that could be a good way forward.
That's something that could have been considered. One-to-one and activities outdoors have been acceptable. I think it's just about managing to do things at various different speeds and times. We have allowed therapeutic interventions to go ahead whereby people are referred in. We did that at the very early stages in December to make sure that if people were having therapeutic exercise or sports, some of it provided by physiotherapists and others, and some people are just personal trainers that actually support that exercise referral kind of approaches. And I know we've had some comments on that. That has since been extended to allow therapeutic referred by health professionals of groups up to 10. And we have received some comments that isn't entirely clear on the Government of Jersey website. I did have a look before we came in, and I think there's an improvement there we need to make that clear. I think we pushed that out via various different sector representatives, but I don't think that message has been heard clearly enough. Sorry.
Kenny says, if I've understood the variables slide well enough, the aerosol transmission risk is also linked to intensity and ventilation. So does it mean that if a facility can demonstrate they've got adequate or superior ventilation, that also mitigates some or all of the intensity risks? So on that, using that calculus of variables, if they've got superior ventilation, they've got everything going for them, surely that puts them in a position that's different to someone else.
I think it does put people in different positions, but as Steve pointed out when we started this meeting, there are some inconsistencies or some unfairnesses. We have to do universal guidance. We don't have the ability or capacity, and a majority of governments don't, to do things differently for individual sectors. It becomes confusing. It means that it's quite difficult to maintain. You know, our aims here are to open the sector as safely as possible, but we do have to do that at a universal level. So we look at treating indoor exercise the same across the environment. And whilst I'm not going to deny that smaller environments with less ventilation therefore might have similar rules apply and be less safe than others, unfortunately that is likely to be the case in some examples. Some places are going to be safer by the preparations that people have put in place. And I think, you know, unfortunately that is a frustration that I think people are experiencing, but I think it creates sustainable messaging to customers, and it keeps staff safe as far as possible. So the more mitigations individual sectors are able to put in place to allow that, to support, to make sure they don't get clusters, to make sure they don't then lose staff to infections, you know, the better.
It does mean that we're moving at the rate of the least equipped of all of the premises then.
I think it means we're moving at the rate of government decision making based on looking at the risk benefit approaches, and about moving at a rate whereby we can't open everything at once. The evidence base says we should not open everything at once. We do things carefully and considered as we move forward. So, and that provides a challenge to various different sectors. You know, there are a number of sectors that are unhappy with the moves, with the discussions, with the guidance that we put in place, and you know, that is regretful.
Beverly asked a very sensible question here. Could you summarise the specific answers that you're looking for regarding intensity, numbers, timing? Because you want these by the 28th, Sunday. So where do we send them, and what are you asking for?
So we come to that. That's the final slide, if you like. So you send them to me, and my email address will appear in a minute, as if by magic. But we have, you know, we can't see a show of hands on here, so we don't know how many people would favour option A or option B. But if people can, yeah, there we go. So just to add to this, as Martin said, we'll be preparing over the weekend papers for Stack. Obviously, I need to know what you guys think to inform that paper in terms of whether there's a strong preference for one or the other option, and your whole thought processes. I've heard a lot of what you've said, and we'll see what comes up at the end of the chat about your frustrations and the snail's pace at which things are moving and the unfairness. All those things are understood and heard. We are moving this forward on Monday, as we told you, through Stack and onwards from there. So in terms of comments, suggestions, feedback, please send them to me. Can I just make a slight request that people are fairly succinct in what they say, because if it's a lengthy email, then obviously that's just going to slow me up even further. And if it's about the frustrations that you have, please send them to me still, but they're not going to go into the Stack paper, because they will know how frustrated the sector is. What really we want to get into the Stack paper is, you know, the majority of people in the fitness sector prefer this option or that option, or there's no strong preference. Half of them fancy this and half of them fancy that.
Okay, the slide deck that you've shared with us today, very generously, thank you for that. Okay with you two for me to send it to everyone who's on this call?
Absolutely.
Got this, and they can look at the questions again. They can then make specific responses to the questions that are asked. Beverly, I hope that helps you, and I hope it helps everyone else. We'll do that. Stick around, because we're not going to finish at 2 o'clock, because I think it would be folly to do so if you two are all right for a couple of minutes. Surely the capacity can be based on an area, can be calculated in a simple way, the same as retail. If there's an obvious disparity between 10 people on a table in a hospitality setting, with only the requirement being 2 meter distancing between tables, can we do the same? So shouldn't we be making a calculus based on the size of a venue as to how many people can be in it for low, medium or high intensity exercise?
I mean, I think it's something that can be considered. I think generally what we've worked on in different areas is restrictions by capacity based on physical distancing. It really depends, obviously, the challenges. People come into restaurants generally in one way, and doing one thing, you know, or 2 things, people might say. Effectively, you know, there's a lot of different considerations to make in the sports sector and the different types of activities that go on. I think we're reluctant to do what places had done previously by setting square meterages and restricting numbers by on that basis. But if that's something that the sector really think we should feel more to investigate further, I think in terms of simplicity of what you can do in the law, having a cap on numbers might be simpler.
Okay, so I'm obliged to make sure I get all the comments out. Glenda says, with transmission in gyms, let's see it. So I've made that comment. I'm just passing the comments on here. Don't shoot the messenger. And Glenda also says this doesn't happen when talking about cafes who don't have the same ventilation and extraction that some of the gyms have got, which are quite superior. So I think good comment made there. They're probably not doing exercise, but I'm not going to ask you to comment on that, because that's, if you like, retrospective to the questions that are being asked. Perhaps we could begin one-to-one activities sooner is one of the comments that's there. So I know you've said that's something you could consider. Is one-to-one up for discussion and consultation?
I mean, we can add one-to-one up for consultation. The issue is that how many people at one-to-one are you going to do? And then, you know, you come back to the same, it could be something that is considered at the first point. You only manage one-to-one with a limit of 10 one-to-one customers at any one time. I think those are some of the wider considerations we need to make.
Okay.
I think at the risk of provoking people, the audience today are the fitness sector. We obviously are writing guidance for the sport and fitness sector together, and I know that they're different, but we are not writing separate guidance for one sport and 2 fitness sector. So the fitness sector one-to-one in the sport sector won't do much for them at all, on the basis that most sports involve more than one person or 2 people.
Understood. I also understand, and you also get the frustration from those that are saying, you know, how can you justify people can sit for 2.5 hours in a restaurant and have burger and chips and a pint of lager, but they can't go to their gym for an hour. And I know that's not lost on you because we've said it before, but at least I've said it because someone else has put it here. We run a 3-floor health club. How are we supposed to run a sustainable model based on a maximum cap of 10 people? This is under 10% of our daily footfall normally. So again, that's coming back to capacity and size. Once you get to those sort of levels, you know, that does seem odd.
Yeah, definitely. So I think what we found, for example, in terms of then we've got issues around concurrent stuff. So we've had the same thing back from hospitality. Similarly, are you saying, you know, that we can't, our limit is up to a certain point? There, some of the environments have much bigger spaces. So it may well be that within each individual room size or environment, that, for example, if you've got separate areas, that it might be number capped. But yeah, those bits of feedback are really important to us.
Okay, thank you. This is a really interesting question. Jersey education sector is using rapid tests, high quality rapid tests, as an effective way of detecting cases, and for millions of the UK residents operating in indoor environments. How effective would high quality rapid tests in Jersey be for the fitness centre? Bearing in mind, there's a lot of memberships involved in here, so they'll know a lot of their clients and a lot of their people. Would rapid testing, as it's used in education, be an additional tool, a helpful tool for gyms that would enable them to open quicker and earlier?
I think it could be. I don't think it's likely to be used in that particular sector. Obviously, we have limited access to the lateral flow testing, and we're looking at investigating other methods and approaches as well. I think for a repeating customer who may be coming kind of like on a regular basis, it's going to be more difficult to do. For other sectors where people are more sporadic, coming once a month, it's much more useful.
Okay, if there was a commercial company doing lateral testing, which I know there's a couple, again, if a gym could prove that they're doing lateral testing before people go in there, I just wonder if it's of any benefit for them.
I think it would be a benefit. It would demonstrate customer security, that they're much less likely, that people are less likely to be positive, or less likely to put kind of infection around to others. Again, it's another piece of feedback that we can take into account, but it's probably unlikely that every gym sector would be able to afford to do such a thing.
All right, interesting. Let me just see. So why can't PTs be allowed back first into their gyms? Personal trainers, that would be PTs, I'm guessing, be allowed back first into the gyms with their clients. So massive gym, one client, one personal trainer. Again, I think we've answered that question in about 5 different ways so far. Someone says we can raise hands and we can vote now. That'll be interesting to see.
That works.
Let's see if this works. This is going to be an unknown to all of us, but we'll give it a try. So you've got option A and option B. And just to remind you, I'm just going to share the screens for a moment so you can just look at these and see where we go. So hopefully you're seeing that now. So that is option A for consultation. So no indoor intensity restrictions, and you'll see phase 1 and phase 2. So that is option A. And this is option B, which is for consultation, which is with intensity levels. Now I'm going to try and see how we read, because I'm looking to see where we raise hands. I know Linda's just raised a hand, but I'm going to try and see if we've got a way of being able to read those. So option A or option B, and we will share these people with email afterwards for those that want to give comments and send them to Steve. That's s.harvey@gov.je. But we'll go back now and see if we can read the hand sharing. I wasn't aware that we could actually get that right now, right here, but people saying we can. So I will try and count these up. But Matthew's saying, I'm with plan A. Gyms will definitely be able to reopen. So that's Matthew's thinking. And Connor says, am I right in thinking the only difference between the proposals is the subject of high intensity? That's the reading, isn't it?
Pretty much it, yeah.
So it's about intensity. We've already stated we're accepting, if required, to adhere to low intensity if it means we can get open. Stack would be aware of this if they had reviewed our recommended strategy that we shared 2 weeks ago. So let me see what else is. Why do we keep referring to sport and fitness as the same thing? They're very different. I'm sure you acknowledge they're very different, but you've been asked to do for both at the same time. Is that right?
That's right.
Okay. With regard to a large swimming pool and the people using it, this would be fleeting contact, says Scott. A lot of people in here are personal trainers who want to work. Can you please think about including that in your plans? So that is that. I'm trying to see if I can see where polls are. Oh, there is a poll. Aha. Right, I'm going to ask a question in the poll. I'm going to try and write it if I can whilst we're doing it, but I'm not sure I can. There it is. Right, so I'm going to ask a question, enter a title for the poll, option A or B. I'm going to see if we can do this. So it's a single choice. Please state your. I've never typed live on these before. Bear with. Okay, folks, I'm going to try and put this in as a question and save if I possibly can in just a second. I've got about 6 screens open, so you'll have to bear with me whilst I do so. That's A. That's B. There should now be a poll in the poll at the bottom next to Q&A in your boxes. If you're watching this, I'm going to launch the poll now. Please state your option as option A or option B. So far, I have, it's going up at a heck of a rate right now, I can tell you. We've had 14 people vote, 16 people vote now. It's in the box that says polls. If you click onto that, it will give you the option of option A or option B. And we've had nearly 20 people vote. If you're still looking at this and you want to know what option A or option B is, it's about intensity. Just Steve, can you just outline the difference between the two, just so they give them the choices for option A or B?
Thank you. So option A would be opening back up with all intensities starting off at the same time. And option B would be opening up with low and moderate intensity only initially, and then followed in the second phase by high intensity being added in.
So you can vote now. At the bottom of the screen, there is a poll. It says polls next to Q&A, and next in between Q&A and chat, where it says polls. We're going to be closing it very, very shortly because we don't want to keep this going open for too long. But it's been quite an interesting vote. And of those who have voted at the moment, make sure you get your votes in as quickly as you can. I know we said raising hands, but ignore the raising hands. We've now got a poll that you can now take part in. We can be flexible. I could be more flexible if I could get to the gym, but then it's another story. Right, here we go. Of those that have voted so far, I can tell you that 70% have gone for option A and 30% have gone for option B. So that is a 70-30 in favour of option A.
How many people voted, Murray, out of interest?
Out of that, 30 people.
30 people. Thank you.
We have 34 left on the call at the moment.
Yeah, but us three are 3 of them, and we're not allowed to vote. So we've got a vote from everyone, I think, almost. Yeah,
pretty much. About 3 or 4 people haven't voted. But down in the poll there, yeah, so 30 people have voted. 21-9 is the vote on that. Now, I know that that's a smaller snapshot, but given those who are in this industry, and we had 60 registered and about 50 watching at its peak. So the attendees now viewing, 30 of the 31 have voted, 96% of those watching right now. So thank you for that. Hopefully that helps you a little bit and gives you some guidance the way forward.
Very useful, thank you.
Natalie wants to know, can you advise what the fallow time would be for each option, as this will affect our option choice? So in between the intensity, I think that's a really, really important thing to ask.
Yeah. So the answer is likely to be a 10-minute fallow period, as before. The fallow period, to be absolutely clear, is a time when there's nobody in the area. It's just left empty. There's nobody around. We're saying that's likely to be 10 minutes, just to allow everything to settle, after which cleaning would then take place. So we need to factor in a fallow time of 10 minutes and a relevant cleaning time, depending on the area in question, before other people then avail themselves.
Sure. Okay. Thank you for that. Ben says he thinks the plan A would be the best option to allow gyms to deliver the experience people want, i.e. lower numbers but higher intensity. So I think that's an interesting point that he's making there. Thank you, Ben, for that. And there have been lots and lots of comments which are kind of outside of getting the questions that you need off you. You know, which is gyms are a vital business, which I think we understand that they are. Why does a public health job? Why do public health oppose this as opposed to non-healthy pursuits like going out eating and drinking? I don't expect you to answer that. These are comments, and I know you're doing your level best with this, best you can. I think perhaps intensity could determine the numbers, high intensity, lower numbers. Yep, that's what you just said. Thank you very much. And on the point of fallow periods, can you clarify what they are required between swimming lessons for children?
I think I just have. I think it's likely to be 10 minutes fallow periods across the piece.
Okay. We've had some robust conversation and comments. All of the comments that have been made, we will, and thank you to someone who's commented about me. I'm just doing my little job as I used to do many years ago. All of the comments that have been on here, we will collate every one of them. We will take out the names because I think it's only fair we do so because we haven't got people's permission to share all of those. And we will give you the flat of all the comments and we'll give you all of the questions so you have them. We'll give you the poll as well. So you've got everything there. And what we'll try and do is also find out where we get all of the information to the data that was being asked for so that we can put a link into that as well. We'll send everyone an email. And if anyone wants to watch this back, it will be on YouTube hopefully tonight, if everything is still working all right and we've still got enough power to get it all fired up because it's at least an hour's worth. We'll try and send as many helpful links as we can. I'll send the slide deck to everyone who's been watching, and let's see if we can get this open as quickly as we possibly can. Thanks to Beverly as well, by the way, who has been really helpful in getting as many people to watch this as possible. And someone else just coming in saying, Steve, Martin, Murray, thank you, because we're in engagement. This engagement thing's pretty important, Martin, isn't it, in terms of this industry? In fact, all of the industries, getting this instant feedback and getting this importance of the urgency of getting one of the few remaining sectors back open again.
Yeah, definitely it is important. And I know people have expressed frustration that we're starting at a late stage around engaging. I mean, it has been a challenge moving forward, within an island environment with limited capacity within teams to move forward, opening various different sectors. We've done our best to engage as quickly and as effectively as possible, and working through the kind of decisions and the support that we have from our stack panel and from competent authority ministers too. So, but having an understanding from people who understand what it's like in reality, being able to provide some of that information, as well as the practical information, but also some of the emotional frustration to a degree as well, provides extra context and helps understand. But it's really important to listen and understand from that perspective. As we say, unfortunately, won't be able to respond to every single situation. The buck stops as ever with government making decisions with our ministers, but being able to present the information as fairly and as transparently as possible to them is our aim as we move forward. That's our job as officers, is to do that, presenting the information we have, which includes the information from those people working in the sector.
Do you know what? We might just get the ministers on next time as well, just to have some extra fun. But I won't even ask you to comment on that.
Longer
mention. we'll include all of the deck and all of the, so people can look at it back again and think more carefully about it. And obviously drop you, Steve, any emails of any comments they've got, which will help them, help you by Monday morning. So Sunday night at the very latest. I'll also put a link in there so those who are not members of Chamber might want to think about joining Chamber so that we can continue being your voice. So thank you very much indeed to everyone watching. I know we've run over time by 15 minutes, but I think it's been worthwhile. We'll see you at the next one. Stay safe, stay well, and let's see if we can get the fitness industry open as soon as possible. Thank you, Martin. Thank you, Steve.
Thank you, Murray, very much. Thank you, everybody.